NaijaidUK is a UK registered charity dedicated to improving health care in Nigeria. They provide medical facilities, training, support services, and equipment to empower Nigerian doctors and nurses. The convener, the brain behind it, Dr. Lanre Nehan Babalola. Come on, put your hands together for her.
NaijaidUK started 2015.
I'm Dr. Afalake Daudu. I'm an anaesthetist. I trained in Cardiff, University of Wales College of Medicine.
Good morning, everyone. My name is Kairi Babalola. I'm a consultant psychiatrist with special interest in neuropsychiatry and bipolar affective disorder.
I'm Yemi Abisogu. I'm a specialist anaesthetist in London, and I specialize in remote location anesthesia.
Education is a vital part, and that's what we're doing today. When we actually then come in contact with people that need our help, our patients, we want to be able to monitor them in a meaningful way, in a way, one that is universal, in a way that we're going to pick the important things, we're going to pick them, the most life-threatening things, we're going to pick them up early as well so that we can begin to treat these people.
So we're going to be talking about CPR and some of the causes of cardiac arrest. What is CPR? It's a process by which you are trying to increase what we call the interthoracic pressure. So you're trying to increase the pressure within the thorax where the heart is so that it can still push blood around. Because the problem with a cardiac arrest is short and simple. The heart stops working. And if the heart doesn't work, then blood doesn't circulate, oxygen doesn't circulate, and therefore anything within that body will die. In the absence of oxygen, it will die.
So if there's any problem with the oxygenation, with the level of oxygen in the blood, then the system that is carrying the oxygen has a problem already because there's not enough oxygen already. So we know that hypoxemia is one of the leading causes of death, of cardiac arrest.
With CPR, it's still dire, but at least the survival rate goes up to about 20 to 30%. Even one life is a valuable life. So even if it's just one person that you save just by doing CPR, it is still really important.
I'm a gynecologist, but since 2008, I've gone into emergency medicine, and I now train, breathe emergency medicine. My pediatrician has once told me that we got results in my facility because we intervened very early. Because the more time you spend, dilly-dallying, the more chance that the patient is not going to make it.
Staying alive. Staying alive. Staying alive.
My name is Marvelous Aliu. Can I meet you?
I'm Dr. Adibowale. I work in Department of Surgery. I've learnt a lot so far, which I plan to put into use in my practice. Boy that needs a first aid, I could be walking on the road. Anywhere I think I'm ready to put what I've learned into practice.
My name is Dr. Ebenezer Aladitanye. I'm a medical practitioner. The experience so far has been quite impactful, and I can tell you that it's very educative and informative as well. And I've really learned a lot, and it's something I hope to put into action even as I get to my own primary place of assignment. So.
My name is Dr. Azanulumide Damilola. I'm a doctor.
I'm Dr. Alanoluwatu Bloba.
I am Dr. Adekoya Morenike.
Dr. Fadi Abiola.
Okay, this has been very insightful. It has been very educational, and it has made me realize how much further we need to go as a country, basically, in terms of healthcare and emergency services.
It actually exposed me to new methods like the early warning signs that was mentioned. It's not something that we've adopted here in Nigeria, and it seems like a very good protocol, and it would be nice if we could adopt it.
It's been really insightful, very enlightening, and it just made me realize even more that we as medical professionals, we need to do more in terms of educating the masses.
All right, so this session has been very insightful. I learned about the chain of intervention and the importance of the levels of prevention in addressing emergencies, and also the need for devices called automated defibrillators.
We are paramedics from the Lagos State Ambulance Service, so we have nurses. Okay, and what we do is pre-hospital care. We provide pre-hospital emergency care within Lagos State. That's what we do. It's very important to have knowledge, because what you don't have, you cannot give. So, coming here today, we've been able to, gain a lot. This is what we've been doing, but we've really had more experience. The techniques that has been practiced abroad, we get it here now. So it has really added to the body of knowledge that we have now. So we are very grateful to the organizers of this program, NaijaidUK. We are very grateful. Thank you, guys.
JESUS. Come on, put your hands together.
NaijaidUK cannot be NaijaidUK without this set of people that I want to acknowledge. And please, if you permit me, I'm really blessed today because we happen to have all of our trustees from the UK present. And this is the first time it would happen. Permit us to welcome one of our first trustee, Morenike Ajayi, MBE. Dr. Akim Sule, Mr. and Mrs. Oshunaike. A round of applause to them. And now, I'm going to now recognize some of our supporters. So without these ones, NaijaidUK will not be NaijaidUK. We will not be able to do this for free. So please, I'm calling on Jigbengi. She's baby, but they call her that. Fasairo. A round of applause. In London, they call her Jigbengi. That's how they call the baby. Dr. Flaky. So I want to recognize her, Francesca Ayola. So it will be taken on her behalf to Mr. and Mrs. Oshunaike, Dr. and Mrs. Sule. So we're handing this over to
Lagos University Teaching Hospital, Lutz, Surulere, Idiaraba.